All right, it is 7:50 in the morning. Got a question for you. How are your pet's eyes? Dr. Jerome Williams joins us along with Dr. Susan Nelms to explain. And we don't often think about our dog's eyes. We think about our human eyes because, like me, I can't see anymore. Once I turn 40, it's like I can't see nothing. But talk about some of the issues with pets. And
well, you know, a couple of weeks ago I had lens cataract surgery. And cataracts are probably the most common one of the most common aging problems in dogs. And Dr. Nelms is going to tell us all about her pet here that she has with us.
Okay.
This is Tina Rose, and she's a little Chihuahua Papillon mix that we adopted from the Greater Birmingham Humane Society. And I think that one thing that surprises people about dogs with cataracts, one of the more common reasons that we see them is for genetic factors. So many young purebred dogs or mixes of different pure breeds can have cataracts, and that's actually more common even than the aging changes that are more common for people. So
what should pet owners look for? Like, what are the immediate symptoms? Are they quite noticeable?
Yeah, if you look at Tina Rose, her left eye has a more advanced cataract and it's very cloudy.
Right.
The right eye has a smaller one that's coming on.
Oh, yeah,
and
I see that
so the cloudiness, and she's actually starting to have some vision problems. So we're going to be getting ready to do surgery on her. She's reluctant to go upstairs or go down hallways or jump up. She normally sleeps in bed with my daughter. She's very pampered, and she's not able to jump up anymore.
Now,
So
the success rate for surgery is usually pretty good?
Very, very good. I can attest to those that we refer to Dr. Nelms.
The success rate has really come a long way, but there are some huge differences between dogs and people, and their eyes react with much more inflammation than a human eye. So the aftercare is and follow-up is much more involved for a dog than for a person.
What about preventative measures? Anything you can do, or is it just going to happen?
If it's going to happen, it's going to happen, and the breeding and genetics is a huge factor for our dog patients.
Okay, and then what about aftercare, after surgery, post-surgery?
Much more for a dog than a person. That's
Really?
huge, that if you're not up for doing the post-operative care, then probably shouldn't go for the surgery. It's a very...
Medication perhaps 2 or 3 times a day, maybe in a collar
at
and
least,
stuff?
yes. Eye drops 3 or 4 times a day for the first few weeks, and then gradually tapering, and most dogs actually stay on eye drops to prevent recurring inflammation after surgery long term.
Right.
So
look at you. Look at you. Sweet doggy. All right, Dr. Nelms, Dr. Jerome Williams, thank you so much.
Thank you for having
Good
us.
information about eye care. All right, we got more to come here.